Hello, today we welcome Tilly Metz, member of the European Parliament and member of the Greens. We are very happy to speak to you ahead of the next European election to reflect on the role of patient involvement and to a greater extent the role of health during the next mandate. First of all, first question, could you please introduce yourself and describe the work you have undertaken on health issues during this mandate?
Yes, so my name is Tilly Metz. I'm member of the European Parliament from the Greens, and I'm coming from Luxembourg. And I was one of the, or I am still, one of the vice chair of the Sant committee. This is a quite new created subcommittee to envy and to focus really more on issues of health. And I'm also a full member of ENVI, so the Environment, Food Safety and Public Health Committee. And I also chair quite a number of health interest group in the European Parliament, such as on mental health, but also on women's health. And this mandate was really filled with work around health, and was quite some attention paid to health. We did not finish everything, but we all know, of course, why there was this focus on health is, of course, because of the pandemic. I was also member of the special COVID committee and also member of the committee Europe Beats Cancer, but they are over now. I always about this pandemic, we learned also a lot of things. So I always try to see also the positive things, even though we had the pandemic. I think we all really experienced that it is important to work better together on health issue. And I think a lot of people really became aware also of our dependency towards the pharma industry in so crucial moments as in the pandemic. Yeah, and I think also a lot of citizens became aware of the issue of health when we were confronted also to medicine shortages and also to get in very short time this vaccine. So, and especially the situation of medicine shortages, the general public became also aware that this pure business model of the pharmaceutical industry is indeed not well designed and we need kind of paradigm change there. What we also did during this legislative period, and I think we never spoke so much from a European health union, and the list of specific is very long, also from new tasks for ECDC, for EMA, true reports, as I mentioned already, fight against cancer, the non-communicable diseases, and also a call to adopt a more comprehensive mental health strategy, to develop a pharmaceutical strategy where we're still working on, and also the European Health Data Space, which we are going to vote on next week in the committee. For the second after the trilogue now. So voila, we also have been building up this HERA, but also regarding HERA, so this health emergency response agency. It's not an agency, but
authority.
Yeah, voila, authority, exactly. So a lot of things going on, and quite a lot of things I have been working on. Also, I worked on the regulation regarding substance of human origin, which is really there to protect the donors, but also the receivers of plasma, of blood, of cells in general. And this is really, as I said, where the European Union has some competence, and we really guaranteed that there we have the principle maintained and even strengthened of unpaid voluntary donations, and not going into the direction of more a commercial model, even though there were already posters in Spain, I think it was, where they were calling for young ladies to give their overseat for this sum. So it really made me being worried to see such publicity to call young women to give their overseat, and they get quite well paid for it. So this is a direction we avoided there. So sorry, it was a little bit a patchwork of things that have been really tackled during this legislative period. Yeah.
No, it's true that the last mandate has been very intense with the pharmaceutical legislation and the HTS, etc. A lot of different initiatives and legislation. All of this will naturally impact patients and patient organizations. And this brings me already to my next question on the role of patient organization in healthcare systems. In your opinion, what added value do patient organizations bring to healthcare systems?
Well, for me, they are very, very important partners, not because I'm speaking now to you, but of course, in general, patients' organization like the European Patient Forum, but also national organization are really vital partners in healthcare systems in general, because they are really complementing also the efforts of healthcare providers, of policymakers, of researchers, and they give us real live also information about what are really the needs and the demands of the patient. So they are doing a very important job also in the sense of advocacy for this or this issue or for this or this disease. They give support to the concerned and to the families. So they really play also a role as raising awareness, supporting, advocating, and they really help also to have really a patient-centered approach, and that really tries, or at least should be, equitable and more effective. So I think with the philosophy of a lot of patient association, they are of a real support, as I say, as well as of the people concerned, but on the other hand, also on the side of the policy makers, I think an important partner, a crucial partner. So I think without patients being represented in policy making, we will really tend to make decisions that do not really answer then the needs of the patient, to say it in a short way.
It's true. Thank you for this extensive answer. My last question, you mentioned the work that you have undertaken at the European Parliament during this mandate, and also the role that patient organizations should have during the next mandate. Looking to the future and also beyond the EU election, what are your expectations in the field of health for the next mandate?
Well, first of all, what I would like to say, that health, because of the pandemic, was really now off the screen of all the people, of all the policymakers, of all the politicians. And I would like to, or I commit that we keep health as a priority, because, and also that we should tackle it in a holistic way, in a transversal way. It is about what we eat, it is about air pollution. So it's very linked, especially the approach of One Health, or you can also call it planetary health, so that the environment and how we treat animals has also an impact on our health. So we need to have a more holistic approach to health. And also what I really try to defend is putting the patient really in the center of our concerns. It's not about defending the owners or the stakeholders of the pharma industry, so only a very few. We need to work with the pharma industry for sure, but I think we need to rebalance the power between the public authorities and the pharma industry. So I'm really committed to advocating for improvements that medicine will really be affordable, so that we have also more transparency on the cost. What is really the cost of research and development, of developing medicine? And also, if we put public money in research and the development of the medicine, we need, on the other hand, also then transparency on the cost. And at the end of the day, guarantee that medicine will be affordable and accessible throughout Europe. I also want to tackle, of course, the issue of medicine shortages to make sure that people do not face issues with availability of medicine. So I hope, if I'm re-elected, that I can also work on the Critical Medicine Act. And then another thing that is very important for me is we need to better coordinate research, and we may need to make more public research that it needs to be done. So really non-profit research. And for me, we really need also a safety net regarding the production of medicine that should be in the public hand. So that is something also a little bit, they do it in some way already in the United States to BARDA, and that makes me also speak here about HERA, so which is not an independent agency. And I still believe, from the beginning on, I still believe that HERA should be an independent agency, and I think that would also make the Parliament more involved regarding HERA and have scrutiny over HERA, which is needed. Now it's kind of service of DG Santé, and that is for me not the right way. Another, and sorry to mention so many things, but there are many things we need to tackle in the health sector. We need also to speak about healthcare professional shortages. And I wrote there together with other MPs, but I was at the initiative, a letter also to the council, that we need a more coordinated approach to tackle the shortages throughout Europe. I can speak about Luxembourg, but I can speak also Romania. So throughout Europe, we are lacking 2 million healthcare professionals, and that's something we need also to address, not in installing more competition between the countries, but on contrary, to have a more coordinated approach and to think it's of course about the salary, but that's not the only reasons. It's also working condition, it's brain drain, it's we have big differences nevertheless in certain regions where we have really, and you know the concept in French, the déserts médicaux, really, where you don't find any doctor anymore. And then I mentioned it already at the beginning, and that is a last very important point, the influence of climate change and the environment of health. I think that is very something we should not ignore in the future. And this again is going to be a problem with the more vulnerable population. And of course, people living in the streets, but also refugees, women, children, older people that are going to suffer more and more from issues coming from climate change. I'm not only speaking about heat waves, but in general also the humidity and all the risks that are coming through climate change and the spreading of diseases. Also, as I said at the beginning, how we treat animals in the intensive farming and transporting animals throughout Europe, which really also is fostering, of course, zoonoses and etc. And also the more we take the space of wild animals, the more the risk that viruses jump from animals to humans is, of course, also bigger. So a lot of issues we have. I'm sorry for that, for being so long, that we have to tackle in the next mandate. And that's why, again, I think it's important to continue to work on this EU for health, and not to cut the budget, but in contrary, to foresee more budget in order to have a better and a coordinated European approach.
Thank you. That's very clear. So if I understood well, a holistic and patient-centered approach with a strong focus on topics such as shortages, public health, environmental health, and the European Health Union. Before closing this interview, we wanted to thank you warmly, Mrs. Metz, for the time taken and for your support. So thank you very much.
Thank you. And sorry again that I have been a bit delayed today, but yeah, it was a pleasure to give this interview. Thank you for your interest.
No worries. Thank you.
Bye-bye. Bye.